So, about the rheumatic fever, peak incidence 5 to 15 years of age occur due to pharyngeal infection with Lancefield group A beta hemolytic streptococci, triggers rheumatic fever 2 to 4 weeks later on. Carbohydrate cell wall of the streptococcus cross-react with the valve tissue, antigenic mimicry, and may cause permanent damage to the heart valves. Rheumatic fever is not a communicable disease. It is more common in the low socioeconomic people. Primary attack rate is 3%. Secondary attack rate is 15 to a 50%. Revised Jones criteria is used there. Two major criteria alone is enough, or one major plus two minor criteria is necessary. Okay. So that is for the initial ARF. Two major criteria or one major criteria plus two minor criteria or three minor criteria is for diagnosis of recurrent ARF, that is recurrent acute rheumatic fever. So the major criteria in a low risk population includes carditis, arthritis, chorea, erythema marginatum, subcutaneous nodules. The carditis could be clinical carditis or subclinical carditis. Arthritis is polyarthritis only. And then in case of low risk populations minor criteria, it includes polyarthralgia, fever more than or equal to 38.5 degrees Celsius, ESR more than or equal to 60 mm in the first hour, and or CRP more than or equal to 3 mg per deciliter. Prolonged BR interval after accounting for age variability unless carditis is a major criteria. So that was for the mild, for the low risk population. For the moderate and high risk population, carditis, arthritis. Carditis is clinical or subclinical. Arthritis could be monoarthritis or polyarthritis, polyarthralgia. Chorea, erythema marginatum, subcutaneous nodules, just like that. The minor criteria in case of moderate and high risk population includes monoarthralgia. There it was polyarthralgia. Here it is monoarthralgia. Fever it is a bit lesser. The criteria is a bit lesser, more than or equal to 38 degrees Celsius. There it was 38.5. ESR here is more than or equal to 30 mm per hour. But here, here it is 30. For low risk population, it was only 60. Okay, and CRP is more than or equal to 3 mg per deciliter, same as the minor criteria for the low risk population. And then prolonged PR interval after accounting for age variability unless carditis is a major criteria. So that was about the revised Jones criteria. Okay, so about the clinical features of rheumatic fever. The most common clinical features is polyarthralgia, so like joint involvement. Most rare is erythema marginatum. Early features are arthritis, carditis, and erythema marginatum. Remember ACE. ACE is early, and the late features are SC. SC is subcutaneous nodules and chorea. Okay, so ACE is arthritis, carditis, erythema marginatum. So the joint thing, the heart thing, and the skin thing all comes under early. The late ones are chorea and subcutaneous nodules. Moving on to the major criteria one by one. Carditis. The endocardium, pericardium, and the myocardium may be affected. So the disease which we are looking at is going to be a pancarditis. The mitral valve is almost always affected, sometimes together with the aortic valve. Isolated aortic valve involvement is rare. The characteristic manifestation of carditis in previously unaffected individuals is mitral regurg, sometimes accompanied by aortic regurg. So MR plus AR. Joint involvement. So about the carditis, it's pancarditis, and then mitral valve is almost always affected. A aortic valve may be affected. Isolated aortic valve will not be affected. So whenever the person will usually have MR and AR together. Okay, that's it. And then about the joint involvement, polyarthritis is typically migratory, moving from one joint to another over a period of hours. ARF almost always affects the large joints. The pain is severe and usually disabling until anti-inflammatory medications is commenced. The joint manifestation of ARF are highly responsive to salicylates and other painkillers. So about the joint involvement, it is typically migratory. What type of joints involved? Large joints. How is it? Disabling. Person does not walk. How is it relieved? NSAIDs kudutale it will get relieved. So with this we'll just end. We'll see the others in the next video. Thanks.